Hello everyone and welcome. I'm excited to kick off today's presentation with episode 15. This is our first slide, so I want to start by saying how glad I am to have you here. Today, we'll be exploring some fascinating insights, and I'll give you a quick overview of what to expect. We'll cover the key topics and takeaways, so stay tuned. Let's get started. When it comes to reducing the risk of endocarditis, maintaining good dental care is absolutely essential. In our teaching plan, especially for clients with mitral stenosis, we want to emphasize proper oral hygiene practices. Now, one key aspect is not just brushing, but also how we clean between the teeth. That's where tools like dental floss come into play. Using dental floss correctly helps remove plaque and food particles from areas that a toothbrush might miss. While electric and manual toothbrushes are both effective for cleaning the surfaces of your teeth, they don't replace the importance of flossing. An irrigation device, on the other hand, can be helpful for some patients, but it's not always the primary recommendation for preventing endocarditis. So the most important point here is that, for clients with mitral stenosis, teaching them how to properly use dental floss can make a significant difference in reducing infection risks. It's about reinforcing good habits that protect their heart health by keeping their mouth healthy. This connection between dental hygiene and cardiac health really highlights the importance of comprehensive care. Let's talk about manual toothbrushes. These are the most common type of toothbrushes we see and use daily. They rely entirely on us to do the brushing, which means technique is really important here. Using the right brushing method helps remove plaque effectively and keeps our gums healthy. One of the key advantages of manual toothbrushes is that they are simple, affordable, and widely available. They come in various sizes and bristle types, allowing us to choose what works best for our individual needs. It's also crucial to remember that how we brush matters just as much as the toothbrush itself. Gentle, circular motions are recommended to avoid damaging our gums or enamel. In the context of overall oral health, manual toothbrushes are a fundamental tool, basic but effective, especially when combined with proper brushing technique and regular dental checkups. Now let's talk about clients with mitral stenosis. These individuals are actually at a higher risk for developing infective endocarditis, which is a serious infection of the heart's inner lining. Because of this increased risk, maintaining good oral hygiene becomes really important. However, it's crucial to do it safely. That means avoiding gum trauma during brushing or flossing, since injuries to the gums can provide a pathway for bacteria to enter the bloodstream. Once bacteria get into the bloodstream, they can travel to the heart and cause infections like endocarditis. So the key takeaway here is that good oral hygiene is essential for these patients, but it must be done carefully to prevent any trauma. This is part of our overall approach to reducing infection risk and protecting heart health in patients with mitral stenosis. Let's talk about the type of toothbrush that's best for oral health. A manual toothbrush with soft bristles is highly recommended. Why? Well, first, it cleans teeth effectively without needing electricity or batteries. The soft bristles are gentle on your gums, helping to minimize any trauma or irritation that can occur with firmer brushes. This is especially important for people with sensitive gums or periodontal issues. Additionally, choosing a soft bristled brush can help reduce the risk of bacteremia, which is when bacteria enter the bloodstream, a concern for those with certain health conditions. Overall, selecting the right toothbrush plays a crucial role in maintaining oral health and supporting overall well-being, which ties into our broader goal of promoting safe and effective dental care practices. Now, let's talk about some common oral hygiene tools and why they might not always be the best choice if not used properly. First up is dental floss. While flossing is essential for removing plaque between teeth, it can actually cause gum injury and bleeding if you're not careful. That's why proper technique and gentle handling are so important. Next, we have electric toothbrushes. They can be very effective, but if used too aggressively, they might overstimulate your gums and lead to bleeding. So, it's all about finding the right pressure and using the brush correctly. Then there's the water flosser or irrigation device. It might seem like a gentle alternative, but it can actually force bacteria into your bloodstream through the gums if used improperly or too vigorously. That could pose health risks, especially for people with certain medical conditions. And you might wonder, why not the other tools? Well, some devices may not be as effective or could cause more harm than good if misused. It's all about understanding these tools and using them properly to support your oral health without unintended consequences. For clients at risk of endocarditis, it's important to recommend a soft, manual toothbrush as the safest option. This helps reduce the risk of bacteria entering the bloodstream during brushing. A soft, bristled toothbrush is gentle on the gums and teeth, which is especially critical for those with compromised heart conditions. Remember, the key nursing exam tip here is to always consider the patient's specific risks and tailor your advice to minimize any potential complications. Keeping this in mind ensures we provide safe and effective oral care for our vulnerable patients.